Welcome. Today, we're exploring Spina Bifida, a complex birth defect that affects the spinal cord. Understanding this condition is crucial for families, caregivers, and anyone interested in the intricacies of the human nervous system. Join us as we delve into the causes, effects, and management of Spina Bifida, providing insights into a condition that impacts countless lives. The exact cause of Spina Bifida remains unknown, but it's generally considered a multifactorial condition. This means it's likely a combination of genetic, nutritional, and environmental factors that play a role. One of the most significant risk factors is insufficient folic acid intake by the mother before and during early pregnancy. Certain medications taken during pregnancy, such as some anti-seizure drugs, can also increase the risk. A family history of neural tube defects can elevate the likelihood of Spina Bifida as well, suggesting a genetic component. However, most cases occur in families with no prior history, making it a complex puzzle for researchers to fully unravel. Spina Bifida occurs when the neural tube, the structure that eventually develops into the brain and spinal cord, doesn't close completely during early pregnancy, usually within the first month. This incomplete closure results in a gap in the vertebrae, the bones that protect the spinal cord. Depending on the severity, this can lead to a range of neurological deficits. The spinal cord and nerves may be damaged or exposed, affecting motor function, sensation, and bowel and bladder control below the level of the opening in the spine. The consequences vary greatly depending on the type and location of the defect. Spina Bifida affects thousands of pregnancies worldwide each year. While the exact numbers vary depending on geographic location and access to prenatal care, the Centers for Disease Control and Prevention (CDC) estimates that about 1,645 babies are born with Spina Bifida in the United States annually. Rates tend to be higher in certain populations and in areas with limited access to fortified foods or prenatal supplements containing folic acid. Public health initiatives promoting folic acid supplementation have been crucial in reducing the incidence of Spina Bifida. The signs and symptoms of Spina Bifida vary greatly depending on the type and severity of the condition. Some individuals may have mild, barely noticeable symptoms, while others face significant physical challenges. Common signs include a visible sac on the back, often covered with skin, or a hairy patch, dimple, or birthmark over the affected area. More severe forms can lead to muscle weakness or paralysis in the legs and feet, bowel and bladder control problems, hydrocephalus, excess fluid in the brain, and scoliosis, a curvature of the spine. Developmental delays and learning disabilities can also occur. The specific symptoms depend on the location and extent of the spinal cord involvement. Prenatal diagnosis of Spina Bifida is often possible through routine screening during pregnancy. This typically involves a blood test to measure alpha-fetoprotein AFP levels, which may be elevated in affected pregnancies. If the AFP level is high, further testing, such as an ultrasound or amniocentesis, may be recommended to confirm the diagnosis. After birth, a physical examination can often detect visible signs of Spina Bifida. Imaging tests like X-rays, MRI, or CT scans can provide detailed views of the spinal cord and vertebrae to assess the extent of the defect and guide treatment planning. Spina Bifida is classified into several types, each with varying degrees of severity. Spina Bifida occulta is the mildest form, where there is a small gap in the vertebrae but no opening or sac on the back. Meningocele involves a sac of fluid protruding through the opening in the spine, but the spinal cord itself is not usually affected. Myelomeningocele is the most severe form, where the sac contains both fluid and part of the spinal cord and nerves. A rare type called myeloschisis is when the spinal cord is open and exposed. Understanding these classifications is crucial for determining the appropriate treatment and management strategies. Treatment for Spina Bifida is multifaceted and tailored to the individual's specific needs. Surgery is often required to close the opening in the spine, ideally performed shortly after birth. This helps protect the spinal cord from further damage and infection. Ongoing management may involve physical therapy to improve strength and mobility, occupational therapy to enhance daily living skills, and assistive devices like braces or wheelchairs. Bowel and bladder management programs are essential for maintaining hygiene and preventing complications. For individuals with hydrocephalus, a shunt may be placed to drain excess fluid from the brain. Regular medical check-ups and monitoring are crucial for addressing potential complications and optimizing quality of life. While Spina Bifida cannot always be prevented, the risk can be significantly reduced by ensuring adequate folic acid intake before and during early pregnancy. Health professionals recommend that all women of childbearing age take a daily supplement containing at least 400 micrograms of folic acid. Fortifying foods with folic acid has also been a successful public health strategy. Women with a family history of neural tube defects or those taking certain medications should consult their doctor about higher doses of folic acid. Avoiding overheating during pregnancy, such as in hot tubs or saunas, may also help reduce the risk. The prognosis for individuals with Spina Bifida varies greatly depending on the type and severity of the condition, as well as the timeliness and effectiveness of treatment. Many individuals with milder forms, like Spina Bifida occulta, live relatively normal lives. Those with more severe forms may face lifelong challenges, but can still lead fulfilling lives with appropriate medical care, therapy, and support. Recent advances in fetal surgery have shown promise in improving outcomes for babies with myelomeningocele. Research continues to explore new treatments and therapies aimed at minimizing complications and enhancing the quality of life for individuals with Spina Bifida. Areas of focus include nerve regeneration, improved bowel and bladder management techniques, and advancements in assistive technology. The future holds hope for improved outcomes and a brighter outlook for individuals and families affected by Spina Bifida.